Welcome back to Practical Pediatrics for Parents, where you can find videos to help keep you and your family healthy. A teacher recently told me that 14 of her students were absent because they were sick, many of them with the flu. So I made this video to talk about the flu, what it is, how people get it, how to treat it if you get the flu, and what you can do to help protect you and your family from getting the flu. The flu is an infectious disease caused by a virus called influenza. It's very contagious and easily spread from person to person. Flu symptoms can include fever, runny nose, sore throat, coughing, sneezing, headache, vomiting, diarrhea, aches and pains, and fatigue or feeling tired. Flu symptoms usually develop 1 to 4 days after you were exposed to someone with the flu, and most people are sick for about a week. Some people with the flu can become seriously ill and may require to be hospitalized. Young children, pregnant women, the elderly, and people with chronic health conditions are at the highest risk of severe flu disease. How contagious and how severe the flu is varies from year to year. In the winters of 2020 and 2021, we did not see much flu as everyone was isolating and wearing masks. But in the US in 2022, 31 million people got the flu, 360,000 were hospitalized, and 21,000 died. You catch the flu when someone with the flu coughs or sneezes near you, spreading virus-containing droplets. These droplets spread through the air and can survive on surfaces for hours. So whether you inhale airborne flu-containing droplets or you touch a surface that has flu virus on it, you have just been exposed to the flu. If you get the flu, there are 2 prescription drugs that can help you get better: oseltamivir or Tamiflu, and zanamivir or Relenza. These medicines work best when they're started within 2 to 3 days of the onset of symptoms. Many people don't get diagnosed with the flu until they've been sick for more than 3 days, making these medications less effective. We do not recommend the use of decongestants and cough medicines in children under 6 years of age, as they have been shown not to be effective and in some cases can have potentially serious side effects. For most patients, the recommended treatment is to keep the sick person comfortable and well hydrated while their immune system fights the virus. Take acetaminophen, also known as Tylenol, or ibuprofen, also known as Motrin or Advil, rest, and drink lots of fluids. If you have diarrhea, you should avoid dairy until the diarrhea has resolved, and drink clear fluids that contain salt and sugar, such as Pedialyte, ginger ale, or sports drinks. The flu is very contagious, and you can spread it to others from 1 day before and up to 2 weeks after the onset of symptoms, but you are most contagious for the first 3 days of illness. To prevent spreading the flu to others, you should stay home if you are sick, and not return to daycare, school, or work until at least 24 hours after the fever has resolved and your symptoms are improving, usually 4 to 5 days after the symptoms started. You should call your doctor if you or your child have the flu and you develop difficulty breathing or shortness of breath, severe or repeated vomiting, not able to keep fluids down, not urinating, or if you have symptoms that were getting better but then return with fever and worsening cough. The most effective way to prevent getting the flu is through vaccination. There are 3 types of flu virus, A, B, and C, and each type has many strains. Every year, scientists make a flu vaccine to protect against the most likely strains predicted to cause the flu for the coming flu season. Because the vaccine is based on predictions, the effectiveness varies from year to year, but usually the vaccine reduces your risk of getting the flu by about half. It also decreases flu severity, and it decreases the risk that you will pass the flu on to others. The only people who should not get the flu vaccine are infants under 6 months of age and people with severe life-threatening allergies to an ingredient in the vaccine. This does not include egg allergy. In the past, there was a recommendation to avoid flu vaccine if you were allergic to eggs, but this is no longer true. People with egg allergy can get the flu vaccine. You cannot get flu from a flu shot. Some people feel that when they get the flu vaccine, they get sick, but the flu shot does not have any live virus. The nasal spray flu vaccine is different and does contain live attenuated flu virus, but even this should not make you sick. As your body responds to the flu vaccine, you may develop fever, headache, and redness or soreness around the site where you got the injection, but these symptoms are mild and don't last long, maybe 1 to 2 days. If you did get sick after getting the flu vaccine, it's likely that around the time that you got the vaccine, you were exposed to sick people, possibly in the waiting room, and you caught their illness. If you wear a mask when you go get your flu vaccine, this will decrease the risk of being exposed to other illnesses and protect you from getting sick. You should call your doctor if you or your child are sick and you're worried that you might have the flu. We're always happy to talk to you to try to figure out if this is something you can take care of at home or if you need a medical evaluation. Thanks for watching.